So do you see patients often with their primary sort of sign or complaint, unexplainable fatigue or just like low energy?
All the time. All the time we do.
Hi, everybody. Welcome to the Follow Your Gut series. Today, I have a very, very special guest I'm so excited to introduce you guys to. As you guys know, Follow Your Gut is all about unlocking what gut health means to us. And it is so much more than digestion. And we want you to know that. So today, without further ado, we're going to be speaking to an amazing woman named Dr. Mary Pardee. I'm going to call her Mary because I'm a casual gal, but Mary is nothing casual. She is a functional medicine doctor. She specializes in gut-brain health. And she's the founder of Modrn Med, which is a super successful wellness consulting company. And it aims to enhance your function, your energy through things like gut health. She's got an awesome course we're going to hear about. We can all take it and it's going to digest everything she knows into one course. So that's a pretty cool thing. We'll hear all about that, but I'll let her introduce herself. Before we do that, you know, I love to do an icebreaker. So Mary, I've got a fun one for you, especially since you're like into nutrition. I love asking questions about food. What's a food you hate?
Good one. I have a couple. The first one that comes to my head is goat cheese. Like I despise goat cheese, and it has nothing to do with nutrition or anything. It's just the taste of it. It's a big no-go for me.
Yeah. Always has been, even as a kid.
Always has been. I think there's a genetic thing to it. Like, I think I taste it differently than somebody else. I'm sure there's like a SNP or something in there, but my dad's the same way. And we both taste like, it smells like sweaty feet. And other people are like, oh, it's kind of like feta. It's super mild. I'm like, what? We're not eating the same thing because I don't taste that.
I hear you. I would have answered grapefruit. And again, obviously not for any nutritional reason, but I cannot even swallow it. So I think there's something about
there is a genetic thing for grapefruit.
Really?
Some people taste it as bitter if they have a certain genetic profile, and other people taste it more as like a sweet fruit flavor.
It is so bitter to me. I can barely swallow it. And I like bitter things. So anyway, okay. So now let's get into it. Why don't you give us a little bit bigger of a background? Tell us about your journey. Were you always into gut health and how you got to your seat today?
I think when you go into alternative, natural, integrative medicine, you usually have a story behind it. So you don't really get here just by a conventional track that you thought was interesting. And that was definitely the case for me. So I grew up and had a lot of GI issues when I was a young girl. Was diagnosed with irritable bowel syndrome, had reflux, always just did not have a happy gut, felt bloated, just felt distended, and saw a lot of doctors at a really young age. Had a colonoscopy, like intense procedures that children, ideally shouldn't be having to do. And I got to the point where I had seen so many people that, one doctor was just like, your chart is so thick. Like, you've seen so many doctors, you've done so much workup. Like, there's nothing else that can be done. This is something that you live with, and there's nothing the matter in terms of like your physiology is fine, but this is something that you're going to have to live with. There's nothing else that we can do for you. And that for me was it was a very hopeless message. And
how old were you when you got that?
That was much later. That was like 24. I got that.
But still so young. You're like, come on, I got to figure this out.
Yeah. And I did not feel good. And so for somebody with, authority and a degree behind him to say, there's nothing else that can be done, it felt so final. It felt so, it felt really hopeless. Just like, this is how you're going to feel, like live with it kind of thing. And so I was really discouraged and very emotional over that whole event. And it was part of the process of me saying, okay, I'm going to start this journey and I'm going to just become the doctor that I was hoping to have and never really found. I did find a naturopathic doctor and worked with her and was really just impressed by her knowledge base and how much she knew about how the body actually works. And she taught me. A lot of people don't know, but doctor comes from docere, which is the root for teacher. And that's really what naturopathic medicine encompasses. It's like, we should be teaching our patients, not telling them what to do. And there's a big difference between those. And so it was really from my own gut healing journey that I became a gut health specialist. So I wouldn't be here today for sure without my own journey. And now I really just want to never leave a patient with that hopeless feeling, because we know that the patient-doctor relationship is just as important, more important than the things that you tell them or give them. So if you don't have that rapport, if you don't have that bond, then the healing process is going to be much slower, if at all possible.
Wow, that's so powerful. I love hearing stories like that. And even though the healthcare practitioner you saw wasn't a very positive experience, it ended up lending to your path in life. So in a way, we have that to thank, right? And that's such a lesson in and of itself. And I know you're very busy too. Like you have more clients than you can even keep up with, which means gut health is a thing. People are, suffering from issues that they can't solve. Is that right?
Yeah. So usually the person that comes to see us has already been to a conventional gastroenterologist. They've already seen their primary care doctor. They've probably seen a nutritionist or maybe even another integrated medical doctor, and they don't have any solutions yet. And so that's why they're seeing us, is that they're still left and they've troubleshooted, they've done Dr. Google, they've tried it all on their own too. And so we're offering more integrative, more in-depth and a different lens, but really, really specifically on GI. It's our main focus.
Very cool. And age all over the place?
All over the place. We don't do a ton of pediatrics, but if they come in, a 9-year-old with IBS, then we do see them. Yeah.
Wow. Okay. I can't wait to dig into this. So, there's so much about gut health. I know you know that, but we're trying to do this in nuggets. So today we really want to focus on energy. And I know you know so much about that. That's one of your, the biggest things that Modrn Med is all about, is driving people's natural energy. Can you just break down the science for us? How is the gut connected to our energy? I want to hear about the science. And then I also want to hear about your anecdotal experience personally, and then even with your clients as well.
To understand this connection, because it seems abstract at first, but it's actually pretty direct when you understand the science of the gut and how it works, and specifically the gut microbiome. So the gut microbiota is a collection of all the microorganisms that live in our gut. And so this is going to be viruses, fungi, protozoa, bacteria. We have about 100 trillion microorganisms that live in the gut, way more than we do human cells in the body. So if we think about it, I like to use the analogy of a city. And so we have a city that resides in our gut that's made up of all these microorganisms. Think of them as little people, right? And all different kinds of little people. So diversity is definitely there. In that city, there's factories and there's companies, and these are what are producing products, just like companies that we have. Those products are things called metabolites. And so your bacteria team together, they make products in their little factories, and those products can then be shipped throughout the entire world or our body. And they travel along our road systems, and our roads in our body are going to be our blood vessels and even our nerves. And so our nerves are able to transmit messages, and those messages are sent because of the products that were made by these little factories. And those messages can go anywhere in the entire body. So things that happen in the gut, those bacteria producing these products, these proteins that then are sent through the nerves and the bloodstream throughout all of our body, that can contact our liver, can contact our brain, can contact our kidneys, can contact our thyroid, any system of the body. And so this is how our gut communicates with the rest of our body. And this is really largely based on this gut microbiome, this little system, this ecosystem, this city that we have inside of us. In terms of these factories, I don't think that there's bad factories and good factories. There's not bad bacteria and good bacteria to some degree. Of course, we can get an infection, but it's more that we don't want any one company or factory to have a monopoly in the city. You don't want somebody to say, okay, we're going to wipe everybody else out. We're the only rideshare app from here on out. You want some healthy competition because it keeps everybody in check so that prices don't go up, things don't go awry, inflammation doesn't rise. And so that's where diversity is so important in the gut, that we want to make sure that no one bacterial species gets a monopoly there and overgrows, overpowers, overtakes. So it's all about this fine balance, this homeostasis that we want to find in the gut. How does one monopolize the others? How does that happen? This can happen because you take an antibiotic. Maybe you take vancomycin, broad spectrum, heavy duty antibiotic, or you take something more mild, tetracycline, but you take it for 3 months because you have acne as a teenager, or 6 months or 2 years. These things are what are actually happening. And that antibiotic wipes out a lot of bacteria. And then one guy is It's like when the market crashes, you can go and buy stock for a really low price. So everybody jumps in. Well, whoever gets that edge, that competition, and says, oh, I'm going to take advantage of this field being wiped clean. There's no other competition nearby. So I'm going to go start up something big right now. And that's how you get an overgrowth of somebody bad, or there's that lack of competition, because antibiotics reduce diversity and they allow for these monopolies to happen. It can be other things too. It could be stress. It can be a different medication. Like there's a lot of things that can affect it, but that's a big one that we see that can happen in terms of medications that can cause it. And in terms of how gut affects our energy levels, so these little products that they make can affect our energy directly and indirectly. And so one example of this, there was a study that was done and they found that 1,000 genes that are expressed in our liver, they're regulated by the gut microbiome, by these factories that are producing these products. And 2/3 of those genes are involved directly in metabolism. So metabolism is like that engine that you have. It's like it's what kickstarts and gives you energy. It's how we burn calories, but it's also how we use calories so that we can think, that we can move, that we have and feel good throughout the day. And so a large percentage of this is coming from this liver expression. Our liver is definitely a center of metabolism for us. What they looked at is they saw that the gut microbiome is largely influencing these genes and our sleep-wake cycles. So our circadian rhythm is also affecting the genes. And those two go hand in hand. The gut microbiome will decrease in diversity if we're sleep deprived. And so that's one way, is that these actual products are going into the liver and they're actually changing metabolism, speeding it up, slowing it down. And this is a survival mechanism for sure. You know, if you don't eat food for a long period of time, your gut microbiome wants to send signals to the liver to say, hey, we should slow down our metabolism so we don't run out of fuel sources. And then you're going to get tired, and then you're going to get, sluggish as well. So that's a big one. And then our gut microbiome also can increase inflammation. And we know that inflammation, when it's present, can actually affect our neurochemistry and increase excitation, like hyperactivate areas of the brain that are inducing anxiety or depression. And so, our mood is also how we feel. So we may say, okay, it's not just my metabolism that's low, but I'm depressed or I'm anxious. And this is why I don't feel like I have a lot of energy throughout the day. And is that affected by the inflammation that's present in the gut?
So do you see patients often with their primary sort of sign or complaint, unexplainable fatigue or just like low energy?
All the time we do. And I will also say, because it's fun to do these talks, but I always want to be really transparent and straightforward with people. It's usually not one thing. So you're not going to take a probiotic and your energy is through the roof now. Mm-hmm. It's almost always cumulative. Like there's a reason where you got to the point of having no energy. Could it be in part what you're eating that's influencing your gut microbiome? Absolutely. Is it also going to be community and who you surround yourself with, where you live and your support system and all your relationships? Absolutely. So it's always almost everything that's contributing, or a lot of things.
So we know that these metabolites, I liked how you put them as like what the factories make, and these things are impacting our energy. You specifically talked about metabolism in particular, and then the sleep cycle. Oh gosh, the abhorrent sleep cycle. I know a lot of people are not getting the sleep they want, even with the, attempt. So like, is it true that if we start, I know it's cumulative and it's more to it than that, but if we start taking care of our guts a little bit more, and I want to hear about what that means from your perspective, but let's just say we start to get a more diverse and healthy microbiome. Does that mean we're going to start sleeping better?
Definitely could. Wow. The body is fascinating and it's so intelligent that it'll throw things off on purpose because something's off. So it's like pushing down a domino. Once you push one down, they all fall down, and we may get to the end and say, okay, sleep's bad, but your gut issues started like 3 years ago. Let's fix that first and build upon it and create a foundation of health. And then things that seem to be unrelated may actually resolve themselves. So sometimes people come into me and they've got a list of 10 things that they want to fix. I'm not going to address each of those things. I'm going to say, where do I think this started? Let's fix. Yeah, the root. Exactly. Like, what's the first domino that fell in your story, your health journey? And then from there, if we can get back and see, first of all, what caused that? Because we have to address that, or else we're just going to keep fixing it on repeat. But if we can really go in and fix that and then create a foundation and make sure that we have a good base board to build from, then we can usually see symptoms that are downstream resolve themselves. And that's really when you start to see good signs of health and energy, cravings, like how you feel. Those are all signs that you're getting healthier along the way.
Okay. So speaking about signs, we know now that one of the signs of a gut that's off track could be, really low energy and fatigue. What else? What else are signs that people, because I think people are only connecting gut health to like if you have diarrhea or constipation. So I know it's more than that. So what are you looking for that give you signs? I think this is connected to the gut as a root, besides just fatigue.
I'm always asking people, first, I'm asking them all about their GI health. And so are you having one bowel movement every day? Do you feel like you're fully going to the bathroom? Because you could have a bowel movement every day, but it's a little tiny thing. It's pebbles, it's hard, and you don't feel like you're fully voiding. So how many bowel movements you're having per day? Is it well formed, or is it diarrhea, or is it irregular? Like it's super spontaneous. You have no idea what it's going to be that day. What's the color of it? Like we get into detail. We show pictures of poop. Are you bloated? Do you feel like you're like 9 months pregnant come the end of the day? And in the morning, you actually feel like you have a flat abdomen? Do you pass a lot of gas? Passing some gas is normal. So we have to put everything into perspective. Do you have reflux, indigestion? Like when you eat, it feels like it just sits in your stomach forever. Another big one is to look at skin. Do you have eczema? Do you have psoriasis? We're going to be looking at stress levels too. I always ask people, what amount of joy do you have in your life? Not that your gut is going to cause less joy, but they definitely go hand in hand. If you're not experiencing a lot of joy, that's going to affect your gut health. And so we're really diving in and just doing like a whole systems review and seeing, is there things that we can do to help optimize your gut that will also help optimize your mood or your skin? Autoimmunity, is that present? We want to know pretty much everything about you.
So you're like a detective and you start to get clues, you start to get an inkling that it's gut health related. Are the changes you suggest specific to the symptoms they're having? So let's say somebody has fatigue, but good skin versus somebody who has really inflamed skin, but is sleeping okay. Do you have different solutions, or is there kind of like 3 or 4 things that seem to work for all people? I guess what I'm looking for here are there any tips you suggest for people to start to see if it can, help whatever ailments they're experiencing?
Absolutely. And so how we work in our practice is that we treat the individual. We don't treat you for your disease process. So if you come into us, somebody can come in with IBS that's diarrhea predominant, and we could have 2 people, same diagnosis, and they get a very different treatment plan because they present differently. Their life is different. What they're eating is different. We want to tailor it to the person, and their whole story is different. So we're really figuring out, like, did this start when you got a divorce, or did it start when you gained 50 pounds and started eating differently? These are all different things to consider. And so it's going to be based on the person. But to get back to your question, there are things that you can do to see, okay, if I change these things, how much better do I get? And so something that I advocate that you can do before you even see a functional medicine or a naturopathic doctor is to play around with your diet. So the foundations of health are diet, exercise, sleep, sunlight, sex, relationships. These are non-negotiables. Our health is earned. It's not given to us. So our baseline is not health. We have to earn our health. And these are the things that we need to make sure that are there. And so from a nutrition perspective, one of the best things to see is your gut affected, or is your gut contributing to your skin conditions or to your mood? In my mind is to do a 30-day elimination diet. It's called elimination diet, which I need to find another branding term for that, because it's really a whole foods diet. It's a really healthy diet with tons of vegetables, healthy lean proteins, good healthy fats, even some berries and fruit in there too, but it's taking out anything processed. It's taking out anything that contains gluten or dairy. We also take out eggs, corn, and nuts for the gut specific one. Nightshades are another one too that we'll take out for a little bit. And then you're going to systematically reintroduce these after 30 days. And that's a really important part, because I think eggs are really healthy. I think a lot of the nightshades are very healthy, vegetables for you too. I even think gluten can be a healthy part of the diet. You want to reintroduce these systematically, one at a time, waiting 3 days in between, and see at the end of the 30 days, is your eczema better? Is your psoriasis better? Is your acne better? Is your bloating, diarrhea, constipation, reflux better? And if it is, then that tells you something that you were consuming was contributing to it. And so then you want to reintroduce everything that you can that doesn't bring back those symptoms. And this is where you might want to work with a practitioner to make sure that you can have the most inclusive diet possible and still be really healthy and have minimal symptoms, if any.
Well, the elimination diet is definitely something that I imagine somebody who's really suffering would be willing to do. What if you're not suffering all that much? Like, for example, there's a lot of talk about intermittent fasting and it being beneficial to the microbiome. I'm curious what your thoughts are on that. Even just waking up and having lemon water in the morning, I've heard can be really good too. Like, are there sort of, for those of us that aren't, suffering enough to engage in an elimination diet, things that you would suggest just for an overall good health check kind of behavior?
One of the best things for gut health specifically is walking. So are you walking 10,000 steps per day? Walking helps regulate gut motility, and motility means the movement, how fast or slow your gut is pushing things through. Motility is really at the heart of a lot of digestive issues in my mind. And so walking 10,000 steps per day, super simple. You're also not going to just get gut health benefits, but you're going to reduce your risk for cardiovascular disease, metabolic disorders, everything in between too. So I think that's a really great one to start with. The other one I think is avoiding liquids with meals. Super simple. If you have reflux, if you have indigestion, bloating, burping after meals, take away all of your fluids, drinks from your meals and drink them between meals instead. It's way too much volume and pressure in the stomach to have both food and liquids in there at the same time. Really simple tweak too. The other one is going to be if you just want to take nuts out, like if you're really bloated or have IBS, taking nuts out for 30 days alone, you may be surprised about how quickly you can see results. And nuts aren't bad. It's usually just people that have some GI stuff going on. And so seeing maybe it's just cashews or maybe it's nut butters and you can do whole nuts. That's another great one too. I love the lemon water in the morning. It helps to tell your brain, it's called the gastrocolonic reflex. It says, okay, we're ready to have a bowel movement because I just put something in my stomach. So it helps you have a normal, regular bowel movement each day. And then the other one that I suggest for every human on the planet is a 12-hour overnight fast. And so that means if dinner was at 7 p.m., you're not going to eat till 7 a.m. the next day. Having 12 hours in there gives your stomach and your whole body time to process and go through processes called like autophagy, which is breaking down cellular particles and making sure that we detox them through the body, getting rid of waste. It also helps our GI system go through several cycles of the migrating motor complex, which is a fancy term for the way that we clear out and move food through the intestinal tract and make sure that we have regular bowel movements. 12-hour overnight fast, I think, is a really simple place to start.
Wow. And do you recommend going more if you can? So I think a popular one is it 18 hours? Yeah.
So intermittent fasting, I think, is a great tool for some people. I don't think it's a one size fits all approach. And that's where the 12 hours, I think it is pretty much everybody can do that. With the intermittent fasting, you want to see if you go longer than that. So say you take out breakfast and then you're just going to eat lunch and dinner. Do you have worse cravings? Do you have worse energy levels? Do you feel more irritable? Does your mood change? Do you actually gain weight? Are you losing weight and you shouldn't be losing weight? So you want to just be careful. Women don't do quite as well with intermittent fasting as men. Men can a lot of the times lose weight quickly on it, some men, but you want to be cautious of that because it can be an added stress on the body too, going too long without food. If it's changing your blood sugar levels and you're really sensitive to skipping meals, that's one that I individualize a little bit more versus broad spectrum. Everybody should be on it.
Wow. Mary, so many helpful tips. I want to go back because we went over it kind of quickly and I think it was pretty cool. You said health was diet, exercise, sleep, sex, relationships.
Yeah, I don't think I'm missing any there. Those are the foundations of health. And I was talking about that health is really earned. It's not just given to us. So you need to have those foundationals. Diet, exercise are the ones that we know best. Sleep, in my mind, should be number one. So if you're not sleeping well, but you're waking up at 4 a.m. to go work out, I would say cancel the workout and sleep in. Sleep is number one. You're not going to lose weight. You're not going to feel good, perform well if you're not sleeping. So exercise, diet, sleep, sex, relationships, Sunlight is another one. And then hydration. But those are your big ones right there. I might be missing one. I'm trying to rattle them off the top of my head, but these are the ones that are like non-negotiable. If you don't have one of them, then you're likely not going to have health. And, I think a big one that we take for granted is this like community and relationships. And you said, oh, like I have a bunch of relationships. Are they authentic relationships? Do they bring you joy? Do you feel like you can be yourself in front of these people? Do you feel like there's a few people out there that have your back no matter what? And this is one that I dive in with people because I see people that are biohackers. They've got exercise, they have sleep, they have nutrition dialed in like to a T. They're taking supplements, they're doing all the things. I'm like, oh, what's going on? And then it's like, yeah, I've got friends. I have tons of friends. Do any of them know you? And a lot of the time the answer is like, I've got these friends, but I don't feel like somebody sees me, or I don't have somebody to confide in, or, I don't feel like a sense of belonging in my community. And this is where we like really dive into the good stuff.
I love hearing that there is healthcare out there that incorporates more than just basically drugs. There is one thing missing from the list if it were me, and that would be massages, but that's just me.
I agree. I totally agree. Touch goes back to relationships, community, but physical touch, non-negotiable, tons of studies out there too, but we need it. We need touch. We need intentional touch too. And massages are always nice.
Can you speak a little bit about alcohol too? Like how that might impact the microbiome?
So we backtrack to your first question, like how does one bacterial species monopolize all the rest, or how do we have an overgrowth of something bad? Alcohol is one of those root causes that if you're drinking alcohol on a regular basis, especially in high amounts, it's going to disrupt the gut microbiome, that balance of that city. And there we can get monopolies. We can get bacterial species to overgrow and outpopulate the good guys and create this imbalance where we can get really just a change in that ecosystem that leaves us with immune disruption. So autoimmunity may form, Hashimoto's, rheumatoid arthritis, any of those conditions, small intestinal bacterial overgrowth, which is really at the root of irritable bowel syndrome in general. But alcohol can really disrupt that gut microbiome and allow for overgrowth to happen. The other thing with alcohol is that it's a direct irritant to the gut. And so if you have indigestion, if you have reflux, gastritis, which is inflammation of the stomach, then alcohol is just like adding fuel to that fire, and it's going to increase inflammation. And it's going to worsen all of your symptoms. So removing that as part of your 30-day elimination diet is essential. And then, enjoying, once your symptoms are gone, enjoying an occasional glass of wine socially, I think can be a part of a healthy lifestyle.
What was my other question? It was a little bit about just like why some people can do things that others can't. There are certain people that can just like drink every day of the week and don't seem to like have any impact on things. And then there are people who try to do everything right, and they still get bloating every day. Like, why is that? Is that something they can fix, or is that something fundamentally they're just born with?
I answer this one a lot because like I have people that are frustrated. They're like, why can't I eat everything and my husband can? Or, my best friend has a steel gut and I don't. But in my mind, we all have our canary in the coal mine. So we all carry stress. We all carry things in different places. Some people, it's their gut. And so if they are stressed, if they're emotional, if they, go through even something physically stressful, they get a virus, they may present with gut symptoms more than anything else. Somebody else, they get fired from their job, they break up their boyfriend, like whatever happens, they may get neck pain and get headaches, hold tension in their traps, and they may have chronic migraines or tension headaches. Other people may present with, just an autoimmune condition. Their immune system is that canary in the coal mine. But we really, part of my philosophy is that we carry physical ailments, and emotional things become these physical ailments. So we actually are like storing emotions in the body, and they present in a very physical manner. But I think it's just dependent on the person as to, where is your canary in the coal mine? Like, what's your spot that you present? And it's not a bad thing. It's actually like, I try to rewire people's thinking to say, IBS can be a sign that something is in alignment. So when you get a flare in your IBS symptoms, you're really bloated one day, or you see it creeping on, if you can stop and do like a body scan and just listen and say, what is actually being told to me right now? Is it that I'm moving too fast in life? Is it that my values aren't being portrayed in my actions? Is something out of alignment from a mental emotional perspective for me? And so I think we can really start to view symptoms more as messages telling us, hey, you got to change something. We don't like how you're treating us, whether it's diet, exercise, whatever it is. But it's going to be different for different people, and people are prone to different areas of the body.
I just want to say I'm so glad that you found a calling to this. You really explain these things so well and so easy to understand. I want you to share about this course that people who are interested can take. But before that, I just want to ask like how it all ended up for you. So you were really suffering at 24. Are you just like all better now?
Yeah, I know. We got to finish the story, right? Yeah. So 24 was a really tough time. I went to medical school. It got worse. Like going to medical school does not fix gut issues when there's that much stress on you. By the time that I graduated from medical school, my gut symptoms were virtually gone, and currently have no gut symptoms. I will have that like little sign that says, oh, like I feel a little bit more bloated today. And then I pause and I do all my reset things, but I don't have many gut symptoms, if any at all. And I'm only taking magnesium. So I'm not on a million supplements either, which I think is important to realize, that you don't want to be reliant on supplements just as much as, medications. So yeah, it's a good ending to the story.
Very cool. Awesome. So where can people follow you, Mary? I want to hear more about this course because you do explain things so well. And I think you put it to me that it was like, 18 years or maybe it was 9 years of studying and you put it all into this one course. So that's pretty valuable.
So the gut health course I made because I can't see, and even all the doctors in our practice, we can't see everybody one-on-one just because it is a financial investment. And some people don't need to see us one-on-one. So I love, we've had reviews from the course that say I've had IBS for 20 years and I feel a million times better with just doing the things in the course. And that's makes my whole world. And so the gut health course is a 10-day module course where you get over 4 hours of content. We deep dive into IBS, reflux. We talk about how hormones affect your gut, how the mind-body relationship affects it, how the gut microbiome affects your gut. We go into like every detail that my brain could possibly think of about gut health. We even talk about things like fecal microbiota transplantation, like poop transplants. We talk about worm therapy, helminthic therapy. So we get into some very niche and strange things too. But it's a great starting place if you're not able to work one-on-one with a functional medicine or naturopathic doctor. Maybe there's not anybody in your hometown, or you just don't know if it's right for you yet. It's a great entry to functional medicine from a gut health perspective. And so that's hosted by One Commune, and we can share the link with you guys about that course.
Amazing. And they can follow you on Instagram too. I know Modrn Med posts a lot of awesome just tidbits. When we're on Instagram, it's nice to scroll about something that's good for us. So where can we find you there?
So we're all about positivity and empowering people. So at Modrn Med is our Instagram handle. It's MODRNMED. And then my personal Instagram is at dr.marypardee. And both accounts are all wellness promotion, how to prevent chronic disease, the mind-body connection, definitely gut health, but we also talk about hormones and adrenal health and all that other good stuff too.
Okay. So just to wrap up, guys, everybody who's listening, there are so many things that your gut is connected to. We talked about energy today a lot. If you're not sleeping well, that is absolutely a sign that something could be off track. There's some tricks for everybody, 12-hour fast and 10,000 steps, right? So if you're not doing that, start there. Mary mentioned some other things too, like lemon water, an elimination diet if you're really getting serious, eliminating nuts. So a lot of tips here. Hopefully this was helpful. Mary, thank you so much for being on and sharing your wealth of knowledge and your personal experience with us and our followers. I think they're really going to love listening today. And just to close it out, I ask everybody this: follow your gut is Health-Ade's tagline. It means a lot to me. I'm curious what it means to you. Did it spark any memories, or what does it just mean to you?
I love this. This is like the best tagline ever. And it feels like it should be my personal tagline. So follow your gut. For me, what that means is it's that place when you get really quiet and you close your eyes and you ask yourself a big question. And it's that voice that answers back. It's like that deep knowing. It may not be yes, I don't know what it is, but it's your intuition. It's that visceral gut reaction that you get. That's really what follow your gut means. And we all have that if we get quiet enough and we shut down all of our technology and really just go inward. And I think there's a lot of magic that can happen from that place.
Yes. Maybe it's the bacteria talking back.
It might be the bacteria. Are we bacteria or are we human? Yeah. Another great question.
Starts to get real existential like that. I've gone through conversations like that too. Very cool. Well, thank you so much. It means a lot to me too. It means a lot to me that you were here. Thank you. Awesome. Is there anything else you want to share or anything you want people to know?
Treat your gut well, eat tons of vegetables. That's what's fueling that little city inside of you, and have fun and love each other. That's pretty much it. Oh
yeah. Love it. Vegetables, have fun and love each other. Boom. I would add drink kombucha, but that's just
drink kombucha.
Thank you so much, Mary. Have an awesome day and take care. Bye. See you next time.
Thank you. Bye.